Hi, welcome back to my channel. In this video, I'll briefly describe about the determinants of health. According to the WHO, health is a state of complete physical, mental, and social well-being and not merely an absence of disease or infirmity. If we look at the different dimensions of health, the first one is the physical dimension, in which it is a state in which every cell and every organ is functioning at optimum capacity and in perfect harmony with the rest of the body. Mental dimension is the ability to respond to the varied experiences of life with flexibility and sense of purpose. The social dimension is the quality and quantity of an individual's interpersonal ties and the extent of involvement with the community. And the spiritual dimension is the integrity, principles and ethics, the purpose in life and commitment to some higher being. Now, let's see what are the determinants of the health. Now, these determinants will determine the condition of the health of an individual or its impact either in a positive way or a negative. If it is a negative aspect, a person's health is going to be affected and so-called illness or disease will occur. So 40% of it depends it depends upon the behavior of a person, which could determine the health. 28% is the genetic predisposition, and in 2% of cases, it could be the genetic disease where the health of a person can be affected. In 5% of the cases, it is the environment which can have an impact on the determination of the health. 15% is the social circumstances in which the individual lives, and 10% depends on the type of the medical care or the help that the person receives. Now, the determinants of health are those factors that influence the health of individuals and groups. These factors influence health and illness that help us to explain why some people experience poorer health than others. Behavior is the major determinant of health. An individual's behavior, both negative and positive, such as tobacco and illicit drug use, can cause a negative impact. Maybe a person can be addicted to the drug, or due to the overuse of tobacco, there could be, a person can suffer from tongue cancer, mouth cancer, or lung cancers, or any other complications. Or the amount of physical activity that a person maintains. For example, 30 minutes of exercise, which are highly linked to the number of health conditions. Now, if a person exercises for about 30 minutes, his obesity can be taken care of. So that is what I said. An individual's behavior can have both negative and positive impact. The next could be the genetic predisposition, over which we may have a very little control, but the diseases can be controlled or prevented. For example, family history of disease, of cancer or a heart disease. The next determinant could be the social environment. A person's social environment, including personal relationships, workplace, housing, transportation, and neighborhood violence, all contribute to health status. For example, the risk of youth homicide is much higher in neighborhoods with gang activity and high crime rates. The physical environment is another determinant, in which the physical environment is the environment in which one lives, works, and plays. That exposes the individual to such risks as environmental hazards, for example, workplace injuries, or it could be toxic agents, the chemical spills and industrial pollutions. And another reason could be unsafe traffic patterns. For example, there is an absence of a sidewalk, which could cause accidents. the major determinant which I mentioned earlier, that is 10% of it, is the availability of the medical care. So to conclude, these determinants of health can either improve a person's health status or put an individual at risk for disease, injury, and mental illness. The type and availability of medical care contributes to an individual's health. For example, in the current situation of COVID-19 pandemic, there is a growing use and need of setting up of emergency departments, intensive care units, and COVID care units for long-term follow-up. So similar medical care centers need to be set up, or there has to be adequate facilities to prevent and control certain diseases. Thank you. Please do comment below for any clarifications or suggestions.